Take about 30 seconds to join our room here before we officially start. I'm just going to keep an eye on the people popping up. So, well, let's get started. So, good morning to all of you, to Megan, Zayna, Michelle, and Ramona. Thank you for making time to be with us today for this live question and answer session about aging in place, or as we've been hearing over the last 2 mornings, sometimes referred to as aging at home. This session is sponsored by the Saskatchewan Health Research Foundation, and many of us would know that also as SHRF. So thank you to them for the support. So we don't have a lot of time. We've got about 14 minutes, so let's just dive right into this. And we're going to go around the horn and give each of you a chance to respond to this question. And the first question I want to ask to you, because you all presented different modalities or different things to enhance aging in place. But I want to hear from you, why does it matter? Why does aging in place or aging at home, why does that matter? So why don't we start with Megan, and then we'll go to Zayna, Michelle, and then Ramona. So Megan, lead us off.
Well, people are certainly preferences to age at home, and I think that's pretty clear. And part of the reason why that's a good idea is if you meet your preferences, this is also good for your mental health, and you do not have a disrupted social network. So I mostly deal with rural families. If they need to leave the home setting where they are, they need to now go to a different community, and they no longer have access to their social networks and all these things that are really important for maintaining our mental health, our cognitive health, and quite frankly, just making us happy. So I think that's a big part of it. It is what people prefer, and it is better, therefore, for their mental health.
Nicely said. Zayna, why does aging in place, aging at home matter?
Yeah, I mean, it's exactly what Megan said. And not like, just to throw some numbers, before COVID, in every survey of Canadian citizens, something like 90% said that's their preference. That's what Megan said. That's already enough to, make the dominant paradigm. It's now 100% since the fall survey that was done. And, thank you, COVID. So if this is what everybody wants, and as Megan said, it's better for outcomes, and it's cheaper for society, so we can use our capital. It's there's rarely something that's a triple value proposition, very rarely, and that's what it is. So let's just get on with it.
The triple value proposition, and get on with it. We're all going to get T-shirts that say "Get on with it," right? So Michelle, you bring an interesting perspective because you are working very close to the front line, and you interact with the folks that are living in their home. So why is home care, or pardon me, aging in place, aging at home important?
I hear it all the time, right? People want to stay in their homes. They want to maintain that independence, right? They want their identity. They want to remain their autonomy, right? They want to have choice. They don't want to be go to homes where they lose control, right? So they want to remain in their homes, and they're going to do what it takes for that, right? It's going to look different for everyone. Aging in place looks different for everyone, but with resources and support and advocates from families, it can be managed and it can be done. And we have experience working with people where it is successful, right? So.
Thank you for some sort of real life stories there. Ramona, why does it matter? Oh, I think Ramona. So Ramona, if you check the top of your screen, there's 3 buttons there. Oh, okay. Ramona will be listening, and when you get it, if it seems to work, just pop in and say hello, and we'll get you back in. So, a question for all of you then is, some of you, are connected. You see examples from the private sector. Zayna, you presented lots of examples from the private sector or the not-for-profit sector. There's government programs. What is it going to take to help people age in place? Is it policy shifts? Is it money? Is it the nonprofit sector needs to take a lead? What needs to be done here to help people age in place? Let's start with Zayna first.
You know what? All of those is a yes. At the end of the day, I think this is what Canada needs, is a mindset shift. We still have a dominant paradigm of one size fits all for everything. and government has to do this, and it just change your mindset and meet people where their expectations at, and the market will open. And therefore what will happen is if we don't if the traditional players don't step up and change what they're doing, which is like, for example, my org, we're reinventing ourselves for this based on our book, the markets will come up and serve. And that's a lot of the signals we saw in our book. And they're not only private for-profit markets, by the way. There's a lot of interesting foundations and players. They will meet people where their needs are. So either do it yourself or it's going to happen to you.
Okay. Well, we're getting another T-shirt. You're going to have a whole T-shirt line of sayings here. So Megan, what's it going to take? I mean, you're working in the rural settings, so you see differences, inequities, if you will. What's it going to take?
And it's going to take a lot of money. And I think that this is where we've seen the private kind of public sort of partnership sector do a really poor job of reaching rural settings because there's not enough profit margin there. So I do think that when we're thinking about the rural setting, I do think the government really does need to step in. And even though it's very expensive, and if you get that, hardwired line or new technologies, SpaceX is probably going to change this for us very soon. So that's very happy, makes me very happy. But we've been waiting for the utility agencies to do this, and they have not done it in rural settings. SaskTel committed to doing this, I think, about 10 years ago, and they realized it's just economically not feasible. So the good news is as I said, I feel very optimistic with technology advances, meaning that getting the infrastructure into the rural settings will be less expensive, but it really has been a problem with money and a problem with people not having enough profit to make it worth their while to put that investment in, unfortunately, in rural settings.
Okay. Michelle, what do you think? What's it going to take?
It's definitely a way of thinking. We talk a lot about person-centered, person-directed care. And if we're really talking or listening to what people are asking for, a change needs to be made. And also bridging the gap between what people want and knowing what's out there, right? How do we combine those two, right? We know that there's people who want support, and we know that there's people who provide the support to age in place. How do we get that message out there and move forward?
Are you okay, Ramona, or are you still on mute?
I'm okay. It was stuck on mute there for a while. So
Fantastic.
I guess I'll answer this question. I think it's going to take us to really look at the impacts of aging in place and to see the business imperative for it. You've mentioned that it is, more cost effective than long-term care facilities. So it essentially provides an incentive for offsetting that cost by implementing this infrastructure. And we need to start thinking about access to technology, access to internet connectivity, and the basic information infrastructure that's needed to support these technologies as part of the healthcare system. And it can obviously go beyond that. There's potential benefits in other areas, like from education with the pandemic. So yeah.
Thank you, Nola, for the insight. So we've heard, some of you talked about, money. Is it profitable? Yesterday and today, we've heard the term human, humane, humanity used multiple times. That's probably going to summarize everything we've heard. How do we, from the chairs that each of you get to sit in, how do we ensure that it is accessible and equitable in terms of, if you have lots of money, you'll probably be just fine, and you can live in your own home as long as you want and have all the bells and whistles you want to support that. How do we ensure that it's not just for those that have wealth? Let's start with Michelle.
Great question. I just think about some of the people we support currently, right? Who, everyone comes down from different walks of life and whatnot and have different means. And for one, people may not be connected with technology, right, or have the means to do so. So it is government is getting support, right? There has to be some kind of financial support enabled for all people to be able to access and be able to have the opportunity to age in place. So,
Megan?
Oh, Megan.
Oh, okay. Thank you. Okay. COVID has really brought this to the forefront across multiple sectors. The lack of access to infrastructure has really led to a lot of people being isolated in ways that technology could have mitigated. So I feel like we do need a shift, and we need a shift in terms of infrastructure spending. And we can't have them in community settings. So we have been, looking at libraries as places for resources for people who don't have the money to pay for their own, internet and or technology. And then they closed in COVID. So I think it's pretty clear that moving forward, we need to have in-home technologies. And I do believe that this needs to be a government grant or something for people who are lower income to have in-home technologies going forward, because God forbid, next pandemic, we'll see exactly the same phenomenon.
Good point. Ramona.
I think we need to look at the needs of special populations independently. So some of the special populations that I think a unique or tailored approach could be used would be, for example, Indigenous populations, where we have an issue with continuity of care from on reserve to off reserve. So what kind of technologies might be able to help that transition? We could look at other populations, homeless populations, or people who don't have homes. How do we support them and ensure that they have that continuity of care? Other folks may not be able to use their smartphone, so they may need something like an Alexa or something that's a little bit integrated into their actual household. So we may want to look at things like remote monitoring and how we can integrate technologies into that. I just think that there's not going to be a one size fits all, and it's going to be important that we evaluate special populations for their individual needs.
Good point. Zayna.
I'll just add, the reason it's going to have to be equity focused is we kind of have no choice if you look at the numbers. So if you're quite wealthy, and in Canada for this stuff, we're talking just above the, poverty line, to be honest. You can take care of yourself. If you're way, way below, we have social services. That missing middle is where the median of Canadians are. So the median income of Canadians over 65 is $29,000. Okay. So there's not much you can do for that once you pay for food and a little bit of housing. So by default, that's, I think, 67% of the market that we're talking about right now. So you have no choice but to go for that need. And that is going to be it. You have no choice but to confront equity if that's what you do. And that's why I think the nonprofits who are mission oriented and want to have maximal impact at scale are going to be a great vector to do that.
Great point. So as we round the final turn here into our live question and answers session, you each get 15 seconds to answer the question, what gives you hope for aging in place? When you look to the future, what gives you hope for aging in place? Megan.
I think the advances in technology give me a lot of hope. And I believe that, even our own data suggests that older adults are way more open to using technology now that the pandemic has really forced that issue. And I believe that embracing, using, and investing in technology is going to be the future.
Good summation. Michelle.
I agree. Technology for sure is going to help aging in place, but I also think people that are starting to age have voices and they're advocates for themselves, and they're going to demand and they're going to want more. And to me, that's inspiring. And I see that already in some of the conversations I have setting up home support for some of our people. And I think that's very inspiring because their voice will take them a long way.
Thank you. Ramona, 15 seconds.
I think for me, it would be the shift towards value-based healthcare and more data-driven decision-making. I think it'll be quite obvious to see the benefits of home care. Decisions that are truly based on the quality of care, not just the volume. I'm excited about how models of care will shift.
Excellent. Zayna.
One, the demand is there. We don't have to educate the market. It's just supply hasn't caught up. And two, we have rock star women like these women. This is my first time not being on a mantle that are creating the future. So peace out to you ladies.
And that is the perfect way to close it. Thank you, Zayna. Thank you, Michelle. Thank you, Megan. Thank you, Ramona. Outstanding to all of you. Thank you so much. To those of you that are watching, we're going to leave this session. Let's go to the live session. For Joe, Skid Row CEO Roberts, to take us home for this morning. Take care, everyone.
Thank
Bye
you.
now.
Bye.
Hmm.
Bye.